Hi there, I'm Dr. Dan Thompson with DocTalk. My guest, Dr. Bob Larson, is a professor in the Department of Clinical Sciences at Kansas State University. We'll take a look at how far this disease is spread across the nation and what regulations are in place concerning the movement of cattle across state lines.
We've been using Multi-Min for about 7 years. It's one of the most multi-use products that we have here on the farm. Bulls, cows, calves, weaning age cattle, just about everything on the place. If they go through the chute, they get a shot of it. The primary use that we started Multi-Min was in our donor program, in our embryo transplant program. I'd recommend Multi-Min to any producer in the cattle business. Here at Deer Valley, every animal that goes through the chute gets a dose of Multi-Min.
DocTalk is brought to you by Multi-Min USA, manufacturers of Multi-Min 90, sure trace mineral supplementation by timed injection.
Hi there and welcome to DocTalk. I'm Dr. Dan Thompson here at the College of Veterinary Medicine at Kansas State University. And today I'm joined by Dr. Bob Larson. And really good to have you here on the show, Bob.
Good to see you, Dr. Thompson.
And Dr. Larson, for those of you who haven't met him or hadn't seen him, he's been on quite a few of our episodes and we love to have him on the show. He is a professor here in the Department of Clinical Sciences at the veterinary school, but you're not only a professor, but you're an endowed chair here, the Coleman Chair of Production Medicine. And it's quite a title, and it's an honor to have you here on our faculty, and you do a lot of good things for producers, not only in the state of Kansas and veterinarians, but nationally and internationally.
Well, thank you a lot.
So today, we're going to talk about a tricky subject, right?
That's good. Yes.
Today we're going to talk about trichomoniasis in cattle, and it's something that's widespread interest, and it's starting to have an increase spread within our country, within our cow herd. So,
yes,
what is it?
Well, trichomoniasis, or trich, is a disease that's caused by a protozoa. It's a small microorganism that is a venereal disease. It's passed in the act of mating. And one of the reasons that it's so important to talk about it and gains a lot of attention is because of all the things that can cause abortions and pregnancy losses. Trich, or trichomoniasis, is one that can cause the most problems in a herd. In other words, if I come in and I pregnancy check a herd and I've got just a tremendous loss, 30%, 50%, there's not very many things on my list that can cause that kind of loss in cows that were previously pregnant, and I knew they were pregnant, and then now they show up open. There's a very short list of things that can cause that devastating of a loss, and trich, or trichomoniasis, is the top of my list.
Even out there, so we're preg checking these cows at 4 to 5 months.
Yes.
Pregnancy. Even after that, we can have losses due to trich.
Most of the losses will occur before that time.
Okay.
But you can have some later gestational losses. We're mostly looking at losses that occur in the first 2 to 3 months of the pregnancy.
Okay.
So a lot of times they will show up open at preg check, but we could have sworn they were pregnant. They weren't cycling.
Gotcha.
We had fertile bulls in there that they should have been pregnant, and now we've got a bunch of cows that are open.
Wow. So as we talk about this, why? I mean, we understand now that they can be economically devastating to somebody's cow herd. But,
right. Well, a couple of reasons why it's gotten a lot more attention in the last few years. One is this was historically considered a disease more of the western part of the United States. Some of the large range areas that use BLM land, so there's commingled grazing among a number of ranches. It was hard to control, whose bulls were breeding, whose cows. Those kinds of situations really set up the opportunity for venereal disease to spread from herd to herd. And so we always talked about it as being more of a large ranch, large rangeland type of a disease. But that's really not so true anymore. We're seeing it in other parts of the country. We're seeing it in the Central Plains, definitely. We're even seeing it, on into the southeast part of the United States. There's problems in Florida and other parts that were never historically areas where we thought about trichomoniasis. So here in the Great Plains, it's definitely gaining a lot more interest because we're seeing it more.
Well, and today's transportation and marketing, we don't have the regionalization anymore within our beef industry.
That's exactly right. Breeding animals, both males and females, it's very likely that they could be shipped from Wyoming to Kansas or Kansas to Florida, whereas before maybe it was more regionalized. You were more likely to get your replacement animals from a close geographic area. So that's really one of the reasons why we see it in more parts of the country.
Cool. We sure appreciate you watching Doc Talk, and we'll see you here in a minute.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
America's ranchers and farmers have had a long-standing commitment to quality, and now the Checkoff-funded Beef Quality Assurance Program is working with you to improve our product for consumers. At bqa.org, you'll find an array of educational materials about BQA. You can also take our online course for BQA certification. BQA, it's a commitment to quality, it's a process for continuous improvement, and it's about doing the right thing.
If our local animal agriculture industry disappeared, what else would disappear? The buses that get us to school? The playgrounds and ballparks we go to after school? The books and computers that help us learn and grow? Animal agriculture provides millions of dollars in tax revenue that pay for our school improvements, that pave the foundation that will build our future. A message from U.S. soybean farmers and their checkoff.
We've been using the multi-min on our donor cows, and after we started using it on them, we've seen a definite increase in grade number 1 embryos. I like the results that I get using multi-min with the AI conception rate.
Their minerals not up to snuff, you're going to have problems, and I definitely think multi-min is good for, general healthiness of the cattle.
We think multi-min more than pays for itself.
This segment is brought to you by Purple Wave Auction, the easiest, most straightforward way to sell used equipment. Purple Wave, straight, simple, sold. Hi there and welcome back to Doc Talk. I'm Dr. Dan Thompson at the College of Veterinary Medicine. I'm joined by the Coleman Endowed Chair, Dr. Bob Larson, who is a professor in the Department of Clinical Sciences here at Kansas State University's College of Veterinary Medicine. We're talking about trichomoniasis, and you did a great job of kind of telling us what it does and how it sets up and the economic importance of it. But I think the next segment is how do we prevent from getting it? You know, I don't want it in my cows. I don't want it in my bulls. How do I make sure we don't get it?
Exactly. And of course, most herds do not have trich in their herd right now, and so they want to keep it out. It is, again, to emphasize, it's a venereal disease. It's going to be passed in the act of mating. So it's not going to be passed through, nose-to-nose contact or anything like that. It's mating that's going to pass it. The animal that stays infected for a long period of time and can't really clear this organism is the bull, particularly older bulls. And so one of the main ways we can bring it into a herd is to buy a bull that's infected. So to prevent it, I really concentrate a lot on the bulls. I want to make sure that any bull that I bring in has to meet one of two criteria. One is if he's never been with cows. So a young yearling bull, it's never really been with cows, it's passed by mating, so there's no way for him to be positive. So young bulls that have been managed away from cows, you can bring those into your herd pretty confident that they are not going to carry trich into your herd. Now, if you buy an older bull, a bull that's been used in cows before, what we do is we test those bulls. We get a sample by scraping the prepuce of the bull. We've got a couple of different tests we can do in the diagnostic lab, and because this organism isn't shed continually, and sometimes it's hard to get, what we recommend is 3 tests 1 week apart. So we'll bring that bull in, get a sample, test that, do it again in a week, and again a week after that. A bull would need to be negative on all 3 of those tests for me to feel fairly confident that I could import him into my herd and use him as a breeding bull.
Do most of the veterinarians out there, have they gone through some type of continuing education? And have a feel. Is that who does this type of testing?
Yes, a veterinarian is trained to do this testing. We teach it in the veterinary school. There's continuing education. There's a lot of ways for them to kind of pick up this skill and make sure that they can get a good sample for the diagnostic lab.
I was going to say, it doesn't sound like it's something that you just walk out the barn and take samples. It's going to take some restraint. And
that's definitely right. The bulls need to be restrained, so it's got to be safe for both the bulls and the humans that are involved. And again, this is an organism that's a little bit difficult to find and to get on a good sample. So doing it very well and paying attention to the details is important.
What about the cows?
Cows can carry it. Generally, we talk about open cows, moving it from one herd to another. There are a few exceptions, but generally we consider a pregnant cow to not be infected. In that, like I say, there's a few cows that won't read the textbook that could be positive or could be in the process of possibly aborting that calf because she's positive. But generally, if you buy pregnant cows, you're at very low risk for importing trick in those pregnant cows. If you import non-pregnant cows, you're at a higher risk because it's possible that the reason that they're not pregnant is that they had trick, aborted a calf,
Sure.
and are still positive. And so open cows are a little more risky to bring into my herd. Pregnant cows, much less risk.
I think that's a great point. And then we'll take a break here, and when we come back from break, let's talk about, when it does come.
Yeah.
And what a producer needs to do. You've been watching Doc Talk, and we're sure glad you joined us.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
It's the big 94.5 Country Stampede presented by Verizon Wireless. Country Stampede, June 21st through 24th at Tunnel Creek State Park, Manhattan, Kansas. Starring the Zac Brown Band. Toby Keith. Also starring Luke Bryan, Jared Neiman, John Michael Montgomery, the band Perry, Travis Tritt, and more. Buy now and save. Save on your tickets and campsite by going to our website, countrystampede.com. That's countrystampede.com.
This segment is brought to you by Norbrook Laboratories, manufacturers of Noromycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Hi there and welcome back to Doc Talk. I'm Dr. Dan Thompson at the College of Veterinary Medicine, and I'm joined by Professor and Endowed Chair, the Coleman Chair here at the College of Veterinary Medicine, Dr. Bob Larson. And Bob, we had a great discussion earlier about how we prevent it, and one of those things that kind of triggered in my mind is, when we go to the sale barn and we buy one of those open cows or we buy those older bulls, they might not be such a good buy.
It may not be when you consider the risk of what you may be bringing into the ranch.
Yep. So we've got to weigh that. But now we get to the point, none of us really want to ever see this happen, and it doesn't happen very often because we're ahead of the curve in understanding this disease.
Right.
But people are going to get it in their herd.
Yes, we've seen it in some herds in Kansas and throughout the Great Plains. So yes, it shows up, and when it does, I don't have an easy answer for cleaning it up rapidly. We can help we being the veterinarians can help a herd get back clean and get rid of this disease, but it's going to take some effort on everybody's part. The general ways that we attack a herd that is positive, first thing we'll do is we'll limit the breeding season to 60 days or so. In that, we want cows to get pregnant, and if they lose that pregnancy, we actually want to find them as open and cull them, send them to slaughter, not keep them in the herd. A long breeding season tends to increase the risk of having this stay in the herd and infect cows the following year and bulls the following year. Our main emphasis for testing is the bull. We can test cows, but it's much more difficult. It's not as accurate. And so we tend to focus our testing on the bulls. So if I had a positive herd, the first thing we would do is test all the bulls for trick.
Okay.
Again, my 3 times at least on weekly intervals to say they're negative. Any bulls that we find is positive, one of the other bad things about this disease, we don't have a treatment. Okay. There's no way to clear the organism. Basically, the bull's going to be infected for life. Because he's infected for life and it's a devastating disease, we send him to slaughter. So every positive bull we find, we send him to slaughter. Even in a group of bulls that were run together with a cow herd, if a couple of those bulls test positive and a couple of them test negative, I'm probably going to consider the negatives at very high risk as well.
Sure.
And send the entire bull battery that was breeding that group of cows to slaughter, replace them with young bulls that I know are virgins and are not possibly infected, bring those in, and then I'm going to test those bulls at the end of my breeding season to see if they picked it up from any cows.
Gotcha.
And I'm going to have to do that for a couple of years, testing bulls both at the beginning and end of the breeding seasons, keeping my breeding season short, and any cow that is open at the end of the breeding season, she goes to slaughter. She doesn't get sold as a replacement, or she doesn't get rolled over into a different breeding season or anything like that. She's got to go. There is a vaccine that's available that you can give to cows. It's a moderately effective vaccine, and I don't mean that as a dig against the companies that make it.
Right.
In that it's a difficult organism to produce 100% protection. In herds that are positive, a lot of times we will vaccinate those herds because it decreases the amount of shedding, the length of time that cows are positive.
Sure.
That's the other thing is if I know that a herd across the fence from me is positive, I very well may institute vaccination in my herd to try to limit how negative that can be. So the vaccines will not solve this problem. We have to do the testing and culling of both males and females. But as an additional thing we can do, we can use vaccines in those herds to help decrease quite how bad it's going to be.
And I think it's important to know, not always are we vaccinating animals to prevent the actual exposure to this disease or having the animal be infected, but it might decrease the length of time. And then when we're talking about something like this, decreasing length of exposure is
very helpful.
Huge. I think it's a great place to take a break, and I think maybe when we come back, you're pretty knowledgeable on some of the things that are going on state by state and across the U.S. on some of the regs, and some of the producers and veterinarians out there have some interest.
Yes.
We appreciate you watching Doc Talk, and we'll be back in just a minute. This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations.
Recently, U.S. Secretary of Agriculture Tom Vilsack spoke at Kansas State University. As part of the Distinguished Land and Lecture Series, he addressed numerous things, including the immense importance of reconnecting the American public with agriculture.
It's important for those farm groups and for all of us in agriculture to do a better job of encouraging young people to understand where their food comes from. You have a population that can be easily persuaded one way or the other based on what they read or see or what they are exposed to on TV or in a blog. So we need to do a better job of trying to figure out ways in which at a very early age we can get youngsters to understand this is where food comes from. These are the people responsible for food. These are the steps that they take to make sure that the food that you're eating is safe.
This is Agriculture Today from K-State Research and Extension.
Here in Dallas, we're proud that our vehicles use an advanced biofuel called biodiesel. It's made from renewable resources like soybean oil, canola oil, even recycled cooking oil. This year, biodiesel will displace almost 1 billion gallons of fossil fuel nationwide. Our air is cleaner, our economy is stronger, and America's more energy independent. It's working here, it can work in your community. Biodiesel, America's advanced biofuel.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noramectin line from Norbrook is the practical choice for your herd.
This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations. Hi there and welcome back to Doc Talk. I'm joined again by Dr. Bob Larson, who is a professor in the Department of Clinical Sciences. And Bob, we're talking about trick in cattle, and some regs are coming down the pipe. And some states have them and some states don't. And what are your general thoughts?
There's actually most states in the Great Plains area and Midwest are either already have regulations about the movement of cattle with this pertaining to this disease, or are working on those type of regs. Now there are some state-by-state variations, so to really know if you're going to ship cattle into another state, or if you're buying bulls or even females from another state, you and your veterinarian are going to have to work with that state veterinary health department to get those regs and know what needs to be done. But basically the regs have to do in most states with the transfer of cattle across state lines. So if you're going to send bulls across state lines, you either need to be able to prove that they're virgin bulls, young bulls that have not been with cows, or they're going to have some of these tests that we talked about to make sure that they are negative before they can go across state lines.
Are most of them recommending the 3 tests?
Yes, it varies depending on the state, but that's where you go read the regulations. Some it's 1, some it's 3, depending on the way they wrote their state regs. Now, some states also have regulations on movement of females, movement of the cows. Generally, like I was saying, pregnant cows are pretty low risk. So pregnant cows can move across state lines without too much regulation. Open cows, depending on the state, may have some regulatory constraints to moving those open cows across state line for breeding purposes. So you need to be aware of what it's going to take to either bring a bull in or send a bull across state lines, sometimes even females. Some states are also starting to talk about putting some regulations on bull movement within the state.
Really?
So that's another thing we need to keep our eyes open for, that as we move forward in time to get a better control of the disease, some states may implement some within state regulations as well.
What about animals that are going to like a feed yard or something like that?
Generally, because again, this disease really is only passed in mating, and we're not worried about other types of situations. It doesn't cause the animal to appear sick or to feel sick. It just causes abortions. If cows are going to a feedlot then on for slaughter, or bulls are going for slaughter, then the regs are not really in place.
Cool. Sure appreciate you joining us today. It's been a great show, and as always, great information for our viewers and farmers and ranchers across the United States that watch the show.
All right.
Well, thanks again for joining us here on Doc Talk today. Remember, always work with a local veterinarian. And if you want to know more about what Dr. Larson and I do here at the College of Veterinary Medicine at Kansas State University, you can go on the web and find us at www.vet.ksu.edu. I'm Dr. Dan Thompson from the College of Veterinary Medicine at Kansas State University. You've been watching Doc Talk. We're sure glad you joined us, and we'll see you all down the road. Hi there, Dr. Dan Thompson from Doc Talk. Do you have a horse? If you do, you sure won't want to miss the show next week. I'm going to have Dr. Chris Blevins on my show, and we're going to discuss first aid for horses. Whether you have one in the backyard or a stable full, it's sure to be a great show. Dr. Blevins is an assistant clinical professor in the Equine Ambulatory Clinic here at Kansas State University's College of Veterinary Medicine. Please join me on Doc Talk every Monday right here on RFD TV.
Doc Talk was brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
We've been using the Multimin on our donor cows, and after we started using it on them, we've seen a definite increase in grade number 1 embryos. I like the results that I get using Multimin With the AI conception rate,
Their minerals not up to snuff, you're going to have problems, and I definitely think multi-min is good for, you know, general healthiness of the cattle.
we think multi-min more than pays for itself.